I feel very strongly that, yes, it's our job to say, hey, you may regret this, you may say, but I don't think they need psychological evaluations and things to make sure that they go through this procedure. I think that makes women feel discredited.
Well, it's not discrediting. It is to make sure, okay, that they have the capacity, because just exactly what you said. You said, well, I explained to them that they might have a regret. Then what's the point then of sterilizing them permanently then?
Well,
and
because you can't tell, you're making a decision for them then. You're saying that they don't even have capacity to make a decision.
No, I'm telling them that I'm trying not to judge them, and I wish that they would have a professional tell them that they have the capacity and the longevity, in terms of their foresight going forward. We do that with people, let's say, for example, that have Alzheimer's and things like that.
We're not talking about people who have mental
No, but I'm just saying, in general. Well, but we don't know, because we are not psychologists. That's not our profession, even though I feel like sometimes I am a gynecologist. I've been in practice for a long, long time. I understand what everybody is saying, okay? I just don't think that we should permanently sterilize them for that exact thing. I don't know with myself, and I'm just speaking for me personally, that I can put my head on that pillow every single night, knowing that one or two people, and one for me is too many, that would ever have a regret about what they did.
Montana, I know you want to say something. Go ahead.
Yeah. I kind of understand where both of you guys are coming from. I don't exactly fully agree with you, Dr. Minaya, but I understand where you're coming from. Oh yeah. And I understand where you're coming from. I don't think that doctors should be forced to do a procedure, but as an advocate, I have seen doctors that weren't comfortable doing this, also gatekeeping referrals and not letting patients find another physician that can work with them. And that's also not okay. But I do think with the whole psychology thing and having a psychologist involved, if we're going to treat people who want to be sterilized like that, we should also treat motherhood the same way, because I'm not bashing all moms. Oh yeah, okay. I'm just making sure, because there's some people that definitely should not be moms.
I agree.
Right? Yeah.
100%.
Yeah.
100%.
And my old doctor wanted me to try other birth controls first, and I compromised with them. I met there with them, and they had kind of said that they would agree to do it after that, and they just lied to me. They never did. So I had to find another doctor after that. So, I think that yes, there are some people that definitely have regrets, but we shouldn't look at everyone as a generalized statement, right? Because you might get a patient that comes in, they've tried 10 or 15 times to get it done, and they keep getting denied for hypotheticals. So it's I think that while I respect how you feel, I also just want you to at least consider opening your mind a little bit, especially if the patient is informed. There are definitely some patients that are not fully informed. I can say that they do exist, but I think that if a patient comes in, for my sterilization, when I finally got approved, I came in with a binder. I knew about salpingectomy, hysterectomy, tubal ligation, endometrial ablation, everything under the sun. I feel when those type of patients come in, at least try to give them a little bit of credit, because they've gone that extra mile to really be informed.
But Montana, I think that, first of all, it's my personal decision. You're absolutely correct.
Yeah.
You know what I'm saying? I am a patient advocate in every single way.
Good.
Okay? So, and I do listen to people, but like you said so correctly, if you didn't feel comfortable, and certainly if somebody lies to you, that's unacceptable.
It is.
Would I send my patient out to somebody else to try to get what they want? Absolutely. I do it all the time.
Okay, good.
So
I'm so glad to hear that. Thank you.
You know what?
Yeah.
No, don't thank me, because that's all of our jobs. That's the most important thing. Okay, is to listen. But remember, at least for me, my relationships are very, very long term, long term. So I see, kids of kids of kids, right?
Yes.
So for me, if I'm going to see you for at least the next 27 years or so, which I would love to do, I would like to have a wonderful relationship, and it's based on truth. It's based on respect, and if I cannot do something for you, my darling, absolutely, I will send you something.
Okay, good.